Starting with the lecture number 15, Bismillahirrahmanirrahim. Continuing with the topic of drowning. The learning objectives of this lecture will be that I will be discussing in this lecture the appearances in drowning. And after this lecture, we will learn, inshallah, the external findings which are present on the body in case of drowning and internal autopsy findings. The external findings which are important besides other findings which are seen on a case of drowning, the particular importance are the appearance of hypostasis, because it will vary depending upon the type of medium, running water, standing water. Then the appearance of rigor mortis, how it varies in water or in divers or swimmers. Then two most important signs we will discuss which will be visible on external appearance, that is the appearance of Fine-Froth and cadaveric spasm. Then I will discuss in this lecture the internal autopsy findings in drowning, and beside the various appearances within the respiratory tract, the most important is Oedema Aquosum, that is ballooning up of the lungs because of the entry of water, which is specific sign of drowning, and we will discuss what appearances will be seen on the lungs. Then I will discuss the biochemical changes in drowning. So starting with the postmortem appearances in drowning, there are signs of asphyxia unless the death occurs due to other causes. The typical signs of drowning are only well seen in fresh bodies when they have recovered from the water. Because when the putrefaction sets in or there is a delay in examination, these signs will be masked. The typical findings which are visible on external appearance and on internal appearance. On external appearance, there is wet appearance. When you immediately remove the body from water, the clothes will be wet, body will be wet, skin will be wet, cold, clammy, and pale due to contraction of blood vessels being in water. Then eyes will be usually half open and the conjunctiva will be congested and pupils dilated. The face may or may not be cyanotic. Then regarding hypostasis, it is confined to the head and neck and front of chest, being the most dependent part when the body is immersed or present in still water. Then these parts being heavier, they will be lower position, and the postmortem hypostasis will be present on these areas. But when the body is in running water, then the body is constantly changing its position. The body is rolling, constantly changing its position, and there may not be time for fixation of the postmortem appearance in any specific area, because the body is rolling constantly because of the running of water. Then regarding hypostasis, it sets in early because of muscle exhaustion. As death is unexpected and there are rigorous efforts to save himself, and the muscles are continuously at work, and the glycogen content in them is being utilized, and which is the reason that in cases of drowning, death due to drowning, the rigor mortis sets up early. Then, two signs of great concern on external examination: the fine froth formation at nose and mouth, and cadaveric spasm, that is tightly clenched hands. The process of fine froth formation is that is pathognomonic sign, diagnostic sign, and it is about this froth. It is white, copious, sometimes blood stains, lather-like, and it's abundant and increases in amount, that is comes out of mouth with slight pressure or compression of chest, even if you wipe it away. That you wipe away the froth present and slight pressure on the chest, again it will emit out of the mouth and nostrils. This is, you can see the fine white nature of the froth. And this is the froth within the respiratory passages. And you can see there also the fine froth, and the other two pictures are the for Oedema Aquosum, the swelling of the lung. I will discuss it later. And on the right side is the picture showing the froth within the trachea. So this froth formation sometimes is also seen in death due to edematous condition of the lungs, or in certain poisons like opium, cocaine, barbiturates, and organophosphorus, but other findings which are specific for the drowning, they will not be there in those cases. However, in such cases, the froth is also neither fine nor copious. Now the cadaveric space, or the tightly clenched hands. As we know that cadaveric spasm is the last volitional activity at the time of death. That is record of the last volitional activity. As the death is unexpected, in extreme anxious and extreme effort, there is contraction of small group of muscles, usually forearms and hands, and they get hold of the things which comes in contact, the sand, the weeds, or whatever object comes in contact, it is tightly clenched, and the muscles, without going into primary flaccidity, which is a normal sign after death, they immediately go into a spasm, which is cadaveric spasm, and this is ante-mortem phenomena, and this is record of the last volitional activity at the time of death, and the presence of weeds, mud, sand in the tightly clenched hand is indicative of death due to drowning, because it shows the sign of struggle by the victim. This is a photograph showing the weed or grass being caught in the hands, These are some other weeds being tightly clenched in the hands. Then normally there is cutis and serina, or the goose skin. The skin appears granular and puckered with hair standing out. It has got no value in the diagnosis of death due to drowning. It is produced by the spasm of erector pylori muscle due to exposure to cold water at the time of death. This is how the goose skin appears, the standing up of hair. The skin appears puckered. This is another picture. And this sign is also produced by the rigor mortis of the erector pylori muscle. Similarly, the retraction of the penis and the testis is of no value for the diagnosis of death because of drowning. The hands and feet appear like washerwomen hands, and in it the skin is wrinkled, bleached, and sodden. And it is seen on the palmar aspect of the hands and the sole of the feet. And it is due to action of water on the thickened epidermis, which is just a proof that the body remains in water to make the skin sodden. This is not a diagnostic sign of drowning, but just a sign that the body was in water to allow the skin to sodden. So it is not a sure sign of drowning, but it just tells that the body has been in water for a long time. Like it, the hands, so the palms and the hands appear. This is the skin on the sole of the feet, sodden skin. Now starting with the internal appearances. The asphyxial signs will be seen on the body, and water may be found in the middle ear due to violent respiratory efforts. And certain characteristic features are seen in death due to drowning only. And these characteristic features are changes within the respiratory tract, biochemical changes in the blood, and the presence and character of water in the stomach and intestine, and the presence of diatoms in the tissues, and other signs which are indicative of death due to drowning. So regarding the changes in the respiratory tract, the lungs show the best evidence of drowning. The changes which it shows are called Oedema Aquosum. They are waterlogged, voluminous, and bulge out of the chest wall when the sternum is removed. And there are impression of ribs on them because being voluminous and being compressed against the ribs, and there are rib markings, rib impressions on the lungs. Like this, you can see the depressed impressions of the ribs. This is another picture. This is another picture showing the bulging out of the lungs when the rib sternum has been removed. So the emphysema or the Oedema Aquosum is the hyper-expanded and waterlogged lungs. Hyper-expanded and waterlogged lungs because of entry of water in drowning. And the medial margins of the lungs, they meet in the midline. Normally they do not meet, and which do not collapse on the removal from the body. Normally, if you remove the lungs from the body at autopsy, they collapse. But these lungs, they remain over expanded and do not collapse. Petechial hemorrhages are seldom seen because the blood vessels are compressed by the water-filled alveoli, and the respiratory passages usually contain fine white froth. Sometimes this froth is blood-stained, and it may also contain the foreign material which were in the water, like algae, weeds, mud, and sands. And as soon as the putrefaction sets in, this important sign is lost as the fluid transudates from the lungs into the pleura. Now, regarding the biochemical changes. In typical drowning, whether it is fresh water or salt water, the circulation is usually maintained for some time after the lungs are filled with water. An exchange of water and electrolytes will occur between the blood in the lung capillaries and the water in the lung spaces till the equilibrium is established. And since water rapidly enters into the blood in freshwater drowning, there is hemodilution. And this causes hemolysis of the RBCs with liberation of the potassium. Also waters into the pulmonary circulation and first reaches the left side of the heart. And the chloride contents of the left side of the heart are therefore diminished. And in saltwater drowning, all these changes are reversed. That is, there is hemoconcentration because the water is extracted out of circulation and blood become hypertonic, and there is reduced in the volume of the blood, and there is circulatory shock, and death is due to asystole. So because of the hemoconcentration, the RBCs will be cremated, and the chloride contents of the left side of the heart will be increased. The magnesium, which is specifically present in seawater, it is more, hence it is also increased on the left side of the heart. The magnesium contents in seawater drowning, it is increased in the left side of the heart. As the water cannot enter the left side of the heart if the dead body is thrown in water, because the person has already been dead, circulation is not patent, and the blood will not reach to the left side of the heart. Now the water in the stomach and intestines. The stomach contains water which has been swallowed during the struggle. And this may be either salty if it is the drowning in seawater or fresh water or clean or dirty. And it may contain algae, weeds, mud, and sand. This is an important evidence, provided the victim did not drink this water immediately before submersion. So this water by peristaltic movement may enter the small intestine and is absolute proof of death due to drowning. And if the dead body is thrown into the water, it is not possible for water to go beyond the cardiac sphincter into the stomach and enter into the intestine. But when the putrefaction sets in, this important finding will be lost because then the sphincter will be relaxed and the contents may go beyond. So summary of this lecture is that we have learnt the postmortem appearances in drowning, and we have learned after this lecture the autopsy findings, which are specific external and internal autopsy findings. And in external autopsy findings, we have learned, besides other findings of drowning, the hypostasis, the rigor mortis, because they have now the altered appearance because of being in water. Then two most important signs we have learned: the Fine-Froth formation and the cadaveric spasm. Then we have learned the internal autopsy findings, and in internal autopsy finding, the findings in the respiratory tract are important, and the Oedema Aquosum, the ballooning up of lungs because of entry of water, is a diagnostic sign. Then we have also understood the various biochemical changes which appear in drowning depending upon the medium, it is fresh water or salt water. Thank you very much. That's all about the lecture number 15. Now we'll be moving to the next lecture number 16 on the topic of drowning. Okay, take care. Allah Hafiz.